This segment is sponsored by GBMC Healthcare.
According to the National Birth Defects Prevention Network, every 4.5 minutes a baby is born with a birth defect in the United States. Birth defects are the most common cause of death in infants and the second most common cause of death in children between 1 to 4 years of age. Dr. Natalie Blagowidow joins us from GBMC to discuss where we are with current research and to talk to us about possible methods for early diagnosis. Hello, Dr. Natalie. Thank you for joining us.
Thank you for having me.
All right, so talk to me. What is a birth defect?
So a birth defect is any structural change that's present at birth, and it can really affect any part of the body.
Okay, so now what are the most common birth defects that there are?
So the most common birth defect is a heart defect, and that can be anything from a small hole in the heart to a major structural abnormality that requires surgery at birth. But cleft lip and palate, open spine defects, are some of the other more fairly common birth defects we see.
Okay, what are the causes of these birth defects?
So a lot of birth defects are caused by a combination of multiple genes getting together with factors in the environment, and then a birth defect occurs. But other birth defects can be caused by just a single gene that each parent has passed to the baby, and in combination has resulted in a difference in that baby.
Okay, now can you discuss the connection between genetics and birth defects?
So specifically that last thing, so when single genes get involved, that's where we are interested in taking a look at parents and offering them testing for those genetic defects. But again, as I mentioned already, the environment can have a factor, so everything gets together and can cause these issues.
Oh, wow. So can you explain why doctors recommend genetic testing during pregnancy?
So the genetic testing can help us determine if an individual baby is at risk for developing a birth defect. And for example, a common birth defect we'll test for is cystic fibrosis. And those are babies when they're born that can really benefit from treatment right after they're born. In testing the parents and seeing if the baby's at risk allows them to make decisions about the pregnancy, managing the pregnancy, helping the baby out after delivery. And actually, we've had parents tested to see if they have, carry a gene in common, where they've actually figured out that, oh, wait a second, not only is this pregnancy at risk, I've got a child at home who's got the inherited disorder, for example, cystic fibrosis.
Wow. Well, thank you so much for joining us today, doctor. Lots of good info about the battle against birth defects.
Oh, well, thank you so much for inviting me.